What is the best way to handle getting ordinary health care if you've been diagnosed HIV positive without everything being called AIDS?
This can be a real challenge for people, and one of the things that we get at Heal London quite often, in fact I've had a plea from someone this morning who is coming under intense pressure to take AIDS drugs because they were, some while ago previously diagnosed HIV positive. Really, when you're dealing with the medical establishment, it's best, if you can, to minimize their awareness of a diagnosis. So what that means is that if you have made the mistake, let's say, if I can call it that, of going to get diagnosed sometime previously, if you say, this applies in the UK anyway. In the UK, if you got tested or any kind of treatment at a GUM clinic or sexually transmitted diseases clinic, by law they are ring-fenced from informing anyone else, unless, and this is a get-out, unless they think other people are at risk, which of course comes into play or can potentially come into play when they think, if they think you may be having unprotected sex with other people when you're diagnosed positive, even though all studies appear to show that condoms really make no difference to HIV diagnoses. So the thing to do really is, wherever you go for treatment, is try to avoid taking your diagnosis with you for when you go to treatment. Sorry, let me say that again. So when you go for medical treatment for any other condition, try to avoid taking your diagnosis with you, and that means don't tell them that you were ever diagnosed positive. And basically, it helps you, for the most part, if you play down any factors which they may be likely to interpret as incurring an increased risk of HIV infection. For example, if you're gay and you've got something that's really nothing to do with being gay, whenever you go into hospital or go for treatment, one of the first things they're likely to do is ask you to have an HIV test, or have you ever been diagnosed positive? In most cases, it's best to try to avoid letting them know you're gay, quite frankly, because the medical profession's so obsessed about it. It is incredibly difficult to find medical practitioners who are willing to treat you as you are, and if you like, holistically, without being obsessed about HIV. So, really, one thing I can advise people to do is if their medical notes contain that information, and it's kind of pretty much impossible to get it out of your medical notes, if you're not getting a satisfactory response from your existing doctor, then it's probably best to start going around interviewing other doctors if you possibly can. Rather than just putting up with your local doctor, that's to specifically seek out alternative doctors that you can register with, but see if you can get to ask them some questions first. The challenge for doctors is that they may have difficulty in terms of looking after their own protection and their ability to administer medicine. They have to, at least superficially, act according to the same kind of policies that other doctors do. And a surgeon that I know well said, "You're probably right about AIDS, but I couldn't possibly tell my patients this. I'd be struck off." So for their own well-being, they often have to go along with the orthodox opinion. The best thing you can do is find someone who is at least willing to listen and be persistent about finding someone if necessary, and who's willing to look at your health holistically and not be obsessed with a single cause of everything. That's really the best you can do if your medical notes already contain information about your diagnosis. Does that make sense?
Yes, it's a very good information, I think, for people who are in the situation where they have been diagnosed HIV positive. That will certainly act to reduce the bias which could be introduced.
Yes, I mean, someone made a comment recently. I can't believe that no one's put together a list of medical practitioners in London who would be willing to have a different perspective about things. But the reality is, if there are many medical professionals, they're not willing to admit it publicly.
Yeah.
So you may have to find out through discreet inquiries who is willing to at least take one step back from this diagnosis.
Well, that's
but that means you've got to be proactive in finding the right person, not just try to change the attitude of the doctor you've got, because that's unlikely to work.
No, I don't think that's a good idea. Well, what can people who have been diagnosed HIV positive do to improve their chances of survival?
Right, that's a very good question. Interestingly, I was just reviewing some literature this morning from Africa, and in fact at the European Parliament Conference on AIDS in 2003, Dr. Christian Fiala and Dr. Mark Deroux both made presentations to the European Parliament Conference about what's been happening in Africa. In particular, they were focusing on Uganda and Tanzania, both of which at times have been regarded as the epicenter of AIDS. And Mark Deroux in particular was reporting on some information he'd gathered from the Partage charity, which basically looks after orphans in Africa. And one of the points he made is that at first, when they've been going for about 30 years roughly, but when HIV tests first came out, at first they were giving children HIV tests, but what they fairly quickly found was that whether children were diagnosed HIV positive or negative, it made no difference to their recovery as long as they had adequate nutrition and other health care for other things. So after a while, they stopped doing HIV tests because it made no practical difference. And I think that's quite an important point to make, to remind people that the tests themselves are not necessarily indicating any underlying condition. So we can also turn to the Salvation Army in India, in particularly around Mumbai, where they found they'd been looking after people diagnosed HIV positive for about 10 years, and because they were a fairly poor organisation, they didn't have money for AIDS drugs. And they even admitted that, they said, well, we think that as long as people stop doing inherently risky behaviours, that means they have inherent specific health hazards, they get adequate nutrition, they have meaningful work to do, and they have a socially supportive environment. Sorry, let me say that bit again. We can turn to the Salvation Army in India, particularly around Mumbai, where they were looking after people diagnosed HIV positive for around 10 years. And what they found, because they couldn't afford AIDS drugs, luckily, they found that as long as people stop doing behaviours which are inherently harmful, and they have adequate food and nutrition, and they have meaningful work to do, and a socially supportive environment, and access to basic healthcare facilities, the immune system damage could be reversed. So essentially, what they were saying was, as long as the basic necessities for healthy living are present, then really the diagnosis doesn't really make any difference. What I would add to that is adequate rest and sleep as well. Because one case of someone I've been looking at recently, when they had some other health problem, it became apparent that they'd really not been getting adequate sleep and rest because they'd been working nights, but then looking after their children part of the day and being woken up early as well. So they were really not getting adequate, uninterrupted rest and sleep, and that had been carrying on for months and months and months. once they change that aspect of their lifestyle, the other health problems seem to gradually disappear. So I would add adequate rest and sleep as another basic criteria. So really that's what it comes down to. Just look at, the basics.